Everybody needs to be treated with respect. That's what all of our communities need. And within Te Tiriti o Waitangi, we can honour that by making sure that we can practice in that way that truly is mana enhancing, that gives power to our people, and also includes the clinicians and health workforce that are there supporting. The partnership between Te Puawaitanga Ōtautahi Trust and Piki Health Trust is a self-initiated memorandum of understanding about the partnership that we have to improve access for Māori. We share a lot of the similar values around manaakitanga and whakawhanaungatanga, but sometimes within health you don't always get the opportunity to be able to build those relationships, have the longer appointments, and so we see ourselves as just an extension of how to really form those relationships with whānau so that we can work with them on improving their health outcomes and achieving the best they can for their whānau.
We have such a good relationship with Renee Noble, who was a student nurse with us for many years and then a practice nurse, and as she got more and more involved with equity issues, she went and worked with Te Puawaitanga, and she saw openings that we could work together for the benefit of our Māori whānau.
We've known for a long time that one size doesn't fit all, so understanding that actually our whānau wanted opportunities to access primary health care from somewhere other than a medical centre, we thought that we would come on board to support our colleagues, but also to provide other alternatives to seeking primary health care, whether that be in the community or in their homes.
I think the partnership between Piki and Te Puawaitanga has definitely changed my role, I guess, in the sense that I can follow through. I can start out in the community, bring them into Piki and then carry through the journey with them. Often if you're just in the GP and you see your patients, whaiora clients, our whānau in the GP, it kind of stops there. I think the beauty of being with Te Puawaitanga is that I can follow through, I can go out into the community, see them in their homes, and I get a better holistic hōora katoa, like the whole whānau, I can see them all.
As a very low cost access service, we can't help but be aware that there are huge equity issues for quite a lot of our population, but particularly our Māori population. And so anything that was on offer that would improve access for people to see us, we thought was an excellent idea.
We can work both here in the clinic, but we're also in mobile service, so we're here to essentially support the team to provide primary health care in a model that is more fitting for community, as well as also take the opportunity to keep our team top of their scope and building relationships within the healthcare sector with the team who's here at Piki. What we're trying to do is build the workforce to make sure that they have as many tools as possible to be able to work with the whānau as a whole. And if there are any gaps, then we make sure that we link in with those who are specialists in those areas, but we also provide opportunities for our kaimahi to say, actually I need some additional tools in my kete, this is what I need, and how can we upskill?
It's a privilege to be able to go, kanohi to kanohi and with whānau and into their homes, build that rapport, build that trust so that they can have the best health outcomes. But it starts with trust, I think, and whakawhanaungatanga.
Something that we also want to be able to do is make sure that long term we leave Piki with some skills, different ways of thinking. It's by being here, having a presence, recognising the need and then sharing that vision with others, we've been able to support Piki Health Centre.